Hey guys, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be talking about a general overview of cerebrovascular accidents, CVAs, also known as strokes. Let's break it down. As you can see, we have two main types of strokes, ischemic and hemorrhagic. The difference between the two is ischemic is the blockage of a blood vessel, most commonly caused by a blood clot. In contrast, hemorrhagic, think hemorrhage, so this is active bleeding in the brain. Ischemic is more common. It makes up about 87% of all strokes. The other 13% and is accounted by our hemorrhagic strokes. Now, depending on where the active bleeding is, we're going to break this down even farther. So 10% is intracranial hemorrhaging, and then 3% is hemorrhaging in the subarachnoid space. Next, we're going to discuss some general symptoms that we might see in a stroke. Please note this is not an exhaustive list, or not all patients with a stroke will exhibit all of these symptoms. Symptoms are really determined by the area of the brain that is affected, but we're going to go over these general symptoms. So we might see headache, sensory changes, especially on one side of the body, speech or language disturbances, confusion, visual changes, dizziness, incoordination, or difficulty walking. Once again, all these are determined by the area of the brain that might be affected. Next, I would like to discuss some general demographics. So these are factors that a patient cannot change about themselves that might put them at risk for stroke. One of which being age, that's what we most commonly think of, right? So as we get older, our risk of stroke also increases. Female versus male. So if you're assigned female at birth, you're actually more likely to get a stroke than someone assigned male at birth. So this is a difference of about 60,000 more strokes in females versus males per year. Next, if you're Native American or African American, you are more likely to have a stroke. In African American, this is even increased for first-time strokes, and this is about twice the amount in comparison to Caucasian Americans. Lastly, I want to go over a couple risk factors that might put you or your family at risk for stroke. Now, most of these are things that you can change and modify about your lifestyle. So we have obesity, hypertension, diabetes, smoking, alcohol use, inactivity, and cardiac disease. I hope you guys learned a little something about CVAs. Come back to my page to learn more.